Hello and welcome to Speak Up, Listen Up, Follow Up, the podcast from the National Guardian's office. Throughout October's Speak Up month, the National Guardian for the NHS, Dr Jayne Chidgey-Clark, will be in conversation with leaders exploring the theme of freedom to speak up for everyone, and she'll be exploring the impact speaking up can bring to safety, civility and inclusion. In our first episode, Jayne speaks to Dr Henrietta Hughes OBE, the Patient Safety Commissioner and former National Guardian, about Week 1's theme, Speaking Up for Safety.
Everybody needs to be doing this. We all need to be creating these sort of environments of people feeling safe and feeling warm and thanked, and where feedback is embraced.
We hope you enjoy this episode, and now over to Jayne.
Good afternoon, Henrietta. It's an absolute privilege to have you here for this of the weekly podcasts in Speak Up Month, and we're starting with Speak Up for Safety, which is so important, and it felt absolutely natural to invite you as our new Patient Safety Commissioner to come and have a chat with me this afternoon. So can I just kick off with a really open question and ask you what freedom to speak up means for you?
Well, thank you so much for inviting me, Jayne, and it's a real pleasure to be with you. And I know that Speak Up Month is a really important month because it really highlights how people can learn about speaking up and listening up and following up. And freedom to speak up is an interesting phrase, isn't it? Because it's actually having the freedom to speak. See that as psychological safety. A psychologically safe environment where you can ask a question or you can raise a concern without fear of being belittled, victimised or ignored. And I'm sure you're aware of the work of Professor Amy Edmondson, and she describes a psychologically safe environment as one of high support and high accountability, where feedback is embraced and used for learning and improvement. And I see this as very much a leadership behaviour, and creating the freedom to speak up needs to start at the top of an organisation.
Absolutely. I really concur with that, and I love Amy Edmondson's work. And it's not a quick fix, is it? And yes, it starts at the top, but maybe we can talk some more about that in a minute. I just would want to really focus in on patient safety at the start of our conversation. And that's, as the previous National Guardian and now in your new role, why do you see freedom to speak up?
National Guardian, but also in my current one as Patient Safety Commissioner, I've come across so many examples where people have tried to raise things and either been ignored or they've been belittled or victimised, and that's led to untold harm. And there are time and time again we see examples where people haven't been listened to, and it's had to be escalated for weeks, for months, for years or even decades, to the point where all of a sudden it becomes a huge scandal that needs to be investigated. And I think it's really vital that staff can speak up about anything that gets in the way of delivering great care. And it might be an immediate patient safety concern like unsafe medicines or medical devices, but it can also be what I'd think of as latent patient safety concerns. And that could be an environment where there's bullying or harassment or victimisation. And we know that these have a negative effect on the well-being of workers and the safety of patients. And so what's really interesting is that all of these things matter, and freedom to speak up encompasses areas which have traditionally been under the patient safety team, but also human resources and facilities teams. So I see this as everybody's business. But it's also really important, equally important, that patients and their families have the same psychological safety. Because when patients have got questions and concerns, and as a patient myself, I've always got questions. It's not always clear as to what's going on or what's the purpose of a medicine or even an operation. The staff really need to be able to listen and act, and do that in a way which is really compassionate at times of great stress. But the report, the First Do No Harm, that my role is a key recommendation from, showed tragic examples where patients and families were harmed because they didn't get the right information about their medicines. And when they did try to raise concerns, they were ignored and treated to really quite belittling and degrading treatment, in fact. And so they weren't heard. them. And even now, 2 years on, after the report was published, I still see some of the same problems coming up time and time again, because people haven't received the right information and they haven't been listened to. And I see this as a really deep-seated cultural and systemic problem in parts of the health service. And my role is to hold the system to account for substantial changes in many different areas to get to the point where people are listened to, do get the right information, and we can keep people safe as a result.
Thanks, Henrietta. I think there's so much in what you said there, and I see very much your role as Patient Safety Commissioner and mine as National Guardian for Freedom to Speak Up as very complementary, because we're talking about voices from different parts, people who use the services that you're talking about, patients, their families, and friends, to be able to speak up and be heard and listened to and acted upon. And similarly, the work that we do for workers within the NHS and wider across social care and others need the ability to speak up and to be heard, listened and acted upon. And one without the other just isn't going to improve things and make it safer like we all want to see. So I wondered from your experience, and this could be your experience as a GP or your experience in your previous role or your current, when we think about workers speaking up, what do you think stops people within organisations listening and taking action when people up to them?
Well, I think there are lots of barriers that exist, and that was, I found really interesting, thinking about the barriers that might stop people from being able to listen up and follow up. And I think that time is a really important one, skills, knowledge, but also I think fear, because they don't always have the psychological safety that they need to be able to escalate. They might believe that escalating is futile or may reflect poorly on their ability. I think the other thing about it is what I would describe as belief, because we did research looking at different groups of workers and whether they were less comfortable to speak up, and looking at workers from Black and minority ethnic backgrounds. What we found from the research that we did was that they felt that people didn't understand or believe when they wanted to speak up about things that were getting in the way of their delivering great care. And that might have been about microaggression and about discrimination. And so speaking to a Freedom to Speak Up guardian who in some ways could understand or maybe empathise with them more really removed some of those barriers. So I think it's not only sort of looking at the kind of maybe barriers from a perspective of researchers or things like that, but it's actually really asking people what gets in the way. And people are always, in my experience, very happy to share the barriers that they come across, which might be different for different groups of staff. I think there's something also about expectations and role modelling. We found that visible leadership, engagement and communication are all really important. And during the pandemic, there were infection prevention control measures that actually really created problems in lots of organisations for people to be seen and to be able to talk to people in a way that they might have done other sort of barriers to actually being able to sit down and have a conversation. Also really stop people from being able to listen up and follow up in a way that they might want to otherwise.
Absolutely, and that's just so key, isn't it? I think if we have an understanding of barriers, then we can look at organisations at how we can begin to overcome those. And when I'm talking with leaders and when I'm talking with managers, when I'm out on visits, what I very much often hear is, we see a lot of people using routes to speak up, but we're still not getting it right in terms of our responsiveness. What more can we do? And what more can we do? And one of the things I say is, well, are you talking with those managers, with those people in those positions where people are speaking up to them, to say what will help you be able to respond better in a more timely way or a less defensive way? And it's almost like, people aren't born managers to be good managers. And so I think it's really important that we have the conversations in our organisations to say, what do you need? Because this is a key part of your role. This is a key responsibility, to be responsive, to listen to what your teams are telling you, both as individuals and whole teams. And therefore, I think that having training and then having conversations about that and skilling our managers and leaders to do this is absolutely vital. I know that the National Guardian's Office has produced the e-learning with Health Education England, and the one for workers, the one for managers and one for leaders. And I really encourage all our listeners today to be undertaking that e-learning as a first point. And for me, e-learning is only as good as then how you put it into practice. And so using that as a starting point for conversations and for more training and discussion to equip people with the necessary skills. And obviously the barriers of time are really important, and the futility about knowing that your leadership respond and is going to listen when you raise things on behalf of people who are talking to you. So important.
Can I just add something to that, Jane? Because the work that Megan Reitz did showed that senior people think that they're really good at listening up, and junior people think that senior people aren't really good at listening. Up. So I think there's also something about humility and recognizing that your power, from your job title, from your status, from the barriers that senior leaders sometimes create by being so busy, they're always in meetings, and actually knowing that that this casts a very, very long shadow. So you need to work extra hard. With a job title like National Guardian or Patient Safety Commissioner, we are ourselves creating barriers to people feeling comfortable to come and tell us, right? And I think there's something about recognizing that and then looking to see how you mitigate that, and then checking back in saying, did that work?
You're absolutely right. I'm just wondering, in terms of if you think there are any practical tips that you would want to urge our listeners, who may be workers, who may be managers, who may be senior leaders, how they can ensure that when people speak up to them, and I'm talking to us as well, that they are thanked, listened to, and absolutely imperatively action is taken to address those issues that people are raising, and they know what's being done.
Well, I think because it's so many times I've heard people say, oh, well, we have a freedom to speak up guardian, and they always thank somebody when they speak up to them, and they always listen, and they always, give them support and give them feedback. So we have psychological safety in this organisation. And I think it's something like, well, and do you always thank people when they speak up guardian? It almost acts as a bit of a lightning rod in a way, which is to say, oh, if you want to speak up, talk to the guardian. And what I've spent, the time in role, but also subsequently explaining that no, that's everybody needs to be doing this. We all need to be creating these sort of environments of people feeling safe and feeling warm and thanked, and where feedback is embraced. And I think that there's something, I agree with you about the training, and I'm finishing as a non-exec director on a board at the end of this month, and one of the things that has happened there is the chair has put the Speak Up, Listen Up, Follow training onto all of the non-exec directors' objectives. And I think that's a really powerful message that it sends to say this is not about people speaking to the Guardian. It's about everybody having those characteristics and those values of a freedom to speak up Guardian. And then that creates an environment where people are encouraged to raise matters rather than the opposite.
Yeah, that's so true, and that really is such a good message to hear that boards are beginning to do that, and I really encourage that, because I think one of the things for me is that obviously the freedom to speak up guardian role that many organisations now have mandated to have is a key additional role, isn't it? It was never meant as the panacea and everything to come through that route. Still, actually, what you're wanting is for first port of call, wherever possible, you talk to your line manager if there's something that's getting in the way of you doing your job. If it's a particular patient safety issue, you'll go and talk with the patient safety team. If it's something that has got an HR component, you'll go to HR. But what Sir Robert found back in 2016 is that those traditional routes for speaking up were not being used when things were very difficult, hence his recommendation for the Guardian. And so I'm very keen to ensure that organisations, leadership and management understand the totality of speaking up culture. It's not just about having a Guardian and having that tick box, yes, we've got a great culture because of that. So I think that's really important that you've said that. So we're getting near the end of our time. So I wonder if I can ask you a penultimate question, which is what you feel can make the biggest difference to improving speak up culture in an organisation safety. So Henrietta's top tips.
Well, as I said earlier, the organisations who saw the biggest improvement in their speak up culture said that visible leadership, engagement and communication were the absolute key. So I would say if you're wanting to improve your speak up culture in your organisation, maybe maybe have a read about how others have done it, reach out to them, go and visit them, see what it feels like in their organisation, and then come back and have a big conversation with your workforce, with your patient groups, with all of the parts of the organisation that have a part to play in your culture, and then see what people think. The other thing to say is if you do have a Freedom to Speak Up Guardian or Champions network and your exec and your non-exec lead, they can also act as ambassadors for you in the system, really championing, the voice of workers and the benefit that brings to patient safety. And then Speak Up Month, this is a great opportunity to highlight all the activities that are happening nationally, locally, and across ICSs as well, and use your data and your stories so that you can share the different ways that people are speaking up, or maybe they're not speaking up. And when you have, when someone does speak up to you, I would when someone does speak up to you, I would say thank you. Listen to them, offer support and give feedback on the actions that they have led to, because the information that they've given you is a gift. And you will lead an organisation that is safer for your staff, it's safer, and you'll find that when people speak up and identify problems early, you'll be able to prevent untold harm from happening.
Thank you, Henrietta. And so my last question, I wonder if you can give me, please, for October 2022, your Speak Up pledge.
Well, I pledge to amp account so patients get the right information about medicines and medical devices, concerns are acted upon, and there's a swift, coordinated and compassionate system response.
Thank you so much, Henrietta.
Thank you so much for having me. I've really enjoyed meeting with you and talking about speaking up for safety
Thank you so much, Henrietta, for taking the time to come on our podcast. Thank you for listening, and I hope you've enjoyed this episode. Next time, Jayne will be joined by the co-founder of Civility Saves Lives, Dr Chris Turner, to discuss Week 2's theme, Speaking Up for Civility. An episode, we welcome your feedback, so please like, rate and comment. Thank you for listening.